The University of Tennessee Health Science Center has named a new dean of our College of Medicine. Dr. Michael Hocker will begin his tenure in July, and Dr. Hocker currently serves as the dean of the University of Texas Rio Grande Valley School of Medicine, which is located down in Edinburgh near McAllen, Texas, literally on the Rio Grande at the U.S.-Mexico border. So welcome, Dr. Hocker.
Hey, Joe, thanks for having me. And again, thanks to WMC Channel 5 for having me. And it's an exciting time. It's been a whirlwind couple of weeks here, but excited to, look at this opportunity. And my family and I are just truly blessed and excited to join the UT, Health Science Center family and the Memphis community.
Well, thank you, sir. What made the UT College of Medicine job attractive to you?
Yeah, again, University of Tennessee has a great legacy of great education and is well known throughout the country. And the University of Tennessee Health Science Center is one of the top tier programs when you look at, state supported schools. And, the mission is very similar to us here, but what we're doing is more regionally. And I really like the opportunity to join a team that is really looking at how they can change the impact of healthcare and change health disparities across not just a region, but a state like Tennessee. And it's a challenging opportunity, but also a great opportunity for my family and I to kind of get back to the Southeast and join a top tier organization.
Well, let me talk about your resume a little bit. You're a former U.S. Navy flight surgeon. You earned your Doctor of Medicine degree from the University of Colorado School of Medicine. But then you went on to Duke University School of Medicine, where you helped start what is now considered one of our nation's top emergency medicine training programs. You also earned a Master of Health Science and Clinical Leadership from Duke, so I guess we know who you're rooting for in the NCAA tournament. But what are your priorities now coming to UT?
Yeah, I was going to say, I don't think Duke's playing Tennessee yet, but I'll have to decide who I'm going to root for. I don't get a paycheck from Duke anymore, but I do have some ties there. I think that the goals are pretty straightforward and simple. It'll be to continue to build on the 100-year legacy of the University of Tennessee Health Science Center. President Boyd said it best, and, he wants this to be the greatest decade for the university. And the School of Medicine or the College of Medicine and the Health Science Center are a big part of that. I'm thrilled to be joining, Dr. Peter Buckley, and, for he and his team to give me this opportunity is truly just a blessing for me. But we want to be a top tier, nationally competitive, regionally dominant health science center. We have to move medicine forward, reduce health disparities in the region. And the vision of the Health Science Center is to create healthy Tennesseans and thriving communities. And, as a College of Medicine dean, that is our mission and goal over the next, 5 to 20 in the next 100 years.
Here in Memphis, the UT Health Science Center played a leading role during COVID-19. The leadership at the medical school in particular really played a leading role in helping our community get tested and process our dealing with COVID-19. Here in Memphis, we learned a lot about health disparities during COVID-19. A significant number of people in our Memphis community live in poverty, and the poor died from COVID-19 in far greater numbers than those who were better off. What has living and working on the U.S.-Mexico border there taught you about health disparities among the haves and the have-nots?
Yeah, unfortunately, it's, some things are universal. And again, thank you for recognizing the healthcare industry. And again, not just health science centers, but all the affiliate sites there in Memphis. As an emergency physician on the front line of COVID, it was a very challenging time. Here in South Texas, along the border, poverty is unfortunately rampant. Lack of access to physicians, lack of insurance, advanced diseases. And again, I think, when you live in a big city, oftentimes you forget that people don't have access to care or have advanced disease or never get cared for. And again, I've seen that here and other places. And as an emergency physician, I truly believe we should have universal coverage in the fact that everybody should have access to health care. And again, I'm willing to see any patient anytime, anywhere, despite their ability to pay. And I think as a health science center and an academic center, that should be a core part of our mission.
Well, I heard you in your response to my first question. You know about the conditions that we face here in the Mid-South and so much of America, but heart disease, cancer, conditions like diabetes, obesity. We have significant rates of infant mortality, a significant people who face substance abuse. You're going to be training the next generation of troops who are going to attack these problems that have been ongoing for generations. And I know you could write a book in your response. We have less than a minute to go here, but I imagine you're excited about tackling these challenges with fresh eyes, right?
Yeah, I think it's a fresh eyes, but there are some incredible faculty, students and staff already there. So really, my job is to help support them and make sure that they have opportunities to do what they're doing, whether that's high quality clinical care, innovative education where we can, train the next generation of physicians and healthcare providers and do it in a way where they want to stay in Tennessee and also where they want to go to, rural communities and where there's, desert oases of care and make sure that people are there. And then I think academic medicine is life-changing research. So looking at each one of those disease processes and saying, hey, what can we do to change these people's lives here in Tennessee and within the region? And, kudos again to, the University of Tennessee Health Science Center recently received the Carnegie R1 status as a top-tier research institution, which again goes along the same line of, they're really changing life by looking at research and the patients. But I think also that, there's a service within the community. So making sure the College of Medicine and Health Science Center are there working within the community to address all those issues that you just brought up.
Well, Dr. Michael Hocker, the name of this broadcast is A Better Memphis, and we hope you'll help all of Memphis and all of Tennessee become better and healthier in your service at the UT College of Medicine. Thanks for your time today.
Yeah, thank you. Look forward to it.
All right, sir. Thank you very, very much. All right. What